Speaking of birthdays, as we age, body and joint pain comes with the territory. When the pain can't be contained by everyday remedies, there are treatment options you may not have considered and could be covered by insurance. Here with details, Dr. Lisa Patel, sports chiropractor with Texas Rich. Good morning.
Good morning, Deb. Happy birthday.
Ah, thank you. Okay, so you were a competitive soccer player growing up, biology undergrad, but you weren't sure what you wanted to do with your career path until something happened.
Yeah, I actually, back in, I think like 2003, I had gotten into a pretty bad car accident, and I was able to seek some chiropractic care at that time. And within a couple of treatments, I literally jumped off the table and went and applied for chiropractic school, and that's where it brought me today. So I since then have done my sports certification. I'm currently pursuing my sports diplomate. I've worked with a lot of athletes in my office. I currently work with the MS 150, the Houston Marathon, and other various local events. So treat a lot of sports injuries. I help to prevent them. We do a lot of exercise rehab therapy and other muscle therapies in our office. Basically comes down to helping them enhance their performance.
And with Texas Rich, you know, the thing is, we have a tendency in our mind to think, all right, let's just rush off to surgery and fix it. Oftentimes surgery can have its own issues like scar tissue and stuff that can make some things not work, right? So when we say sports and chiropractic, it's really based on the principle of helping the body help itself.
Exactly. Yep. And so for me, it's always been, you know, what can we do more for our patients? Chiropractic care has its place, and even the sports aspect. But for me, it was always what can I do more for my patients to hopefully prevent surgeries, get them off of pain meds. So for about 2 years now, I've worked on integrating my practice. And so, and that's where I've actually added a medical doctor in here, nurse practitioner, and we now do offer regenerative therapy procedures. Which is, I mean, it's great for anybody who suffers from pain that we hit a plateau with the chiropractic care, and now it's okay, what more can we do with them?
Right. Okay, so regenerative therapy, it's non-invasive and surgery-free.
Yes, ma'am. And of course, everybody, you know, gets assessed to see if they're even a candidate. They're all under the care of my nurse practitioner. Me as a chiropractor, I do most of the assessments, musculoskeletal therapy for the patients. But beyond that, the regenerative therapy, they're all under the medical doctor and the nurse practitioner's care.
Yeah.
Basically, comes down to if they have pain, I mean, we can help them.
And that pain can be from a number of things. There's inflammation, there's arthritic and degenerative changes in the body.
Absolutely. It could be in the joints, it could be in the spine, pretty much wherever you're getting pain.
Yeah, and with those treatments, again, everybody's different, and that's the other thing that's good about this. It's not like just a one-use deal, but when you walk in, you look at the whole patient and figure out what it is that they need.
Exactly.
All right. Medicare patients can benefit from this because oftentimes people will say, yes, I need the treatment, but how much does it cost?
Of course. So we do have a particular procedure that is being covered by Medicare. It has to be the actual traditional red, white, and blue Medicare plan. Some of these Advantage plans are not covering it, but of course, everybody is we're gonna check everyone's insurance and pre-qualify them. The best situation would be to have a Medicare plan with the supplemental, because that will cover at 100%. And if you don't have the if you don't have a supplemental, that's still fine. If you have that traditional Medicare, they will cover at 80%. Patients' costs will be the 20%, which is, I mean, at the end of the day, it's still more value behind the treatment, and it's non-invasive, it's surgery-free. We're getting a lot of really good outcomes from this. People that have suffered chronic pain. I mean, Medicare patients are 65 and up, right? So a lot of these patients have gotten chronic pain and knee pain.
These are patients, and some of them were told that they might need joint replacements, and in some cases you can avoid that, right?
Yeah, I mean, we've had one patient in particular. She came in to me. She was one of the first patients that we worked with. She's had chronic knee pain, and after the first treatment, she reported 40% reduction in pain, which is amazing.
Yeah.
So yeah.
And the great thing about this is that in most cases you can get in and out of there, in a little bit of time. You do the injection to the painful area. You schedule your follow-up. You can have rehab if that's necessary. And, Dr. Patel, what people should know is that they don't have to suffer in pain. And when they come in, we talked about all the insurance stuff, let you all figure that out for them. Don't make that stop them from coming in, so they'll know where they stand to get out of that pain.
Exactly. And if if it's something where they worried about the insurance, we do have other cash-based procedures that we do offer in here as well. So we handle everything. Once you get into our office, we take care of our patients really well. So
Yeah, and when you feel good, that is priceless. So Texas Rich can make you feel good. Thank you very much.
thank you.
All right, to get pre-qualified and receive a free consultation with Texas Rich, give them a call at 281-606-0905. That's 281-606-0905. And for more information, log on to texasrich2020.com.